The UN Human Rights Office says it's deeply concerned about the apparent rapid spread of COVID-19 in North Korea. It believes around 700,000 people are ill and that the country's very limited healthcare system is not equipped to cope. Here's our Seoul correspondent Jean Mackenzie.
Dressed as hand sanitizers, North Korean children celebrate their country being COVID-free. Just weeks before Omicron finally breached its defences. The country has done little to prepare for what is now a nightmare scenario. People are unvaccinated, malnourished, and hospitals are not equipped to treat them. Dr. Park works as a neurosurgeon in North Korea.
I've been there over 20 times since 2007. I was working at a major hospital in Pyongyang, and I would have trouble seeing ventilators in the ICUs, and they have trouble getting normal supplies. They reuse things like the scalpel.
Concerned about supplies, Kim Jong-un has been touring pharmacies. There isn't enough medicine, he says. He's ordered the army to distribute stockpiles, but it's unlikely they have what people need.
You need antivirals. They don't have that. I'm certain of it. It's a matter of incredible urgency that we get the pills to them as soon as possible because it has to be taken within 5 days.
Instead, state broadcasts have resorted to the most basic advice. Drink water. Rinse your mouth with salt water. We were sick, this man says, but every night and morning I made us gargle with salt water. North Korea's leader thought he could shut the virus out. For years he's sealed his borders, cutting off food supplies. Lee Sang-yong runs a network of sources inside North Korea. Getting information is difficult, but he's hearing the lockdown is making it even harder for people to get food. In some areas where there are lots of infections, people aren't allowed to leave their homes now, he tells me. In North Korea, if you're stuck at home, there's no way to make money. Suddenly, I'm hearing more cases of people starving to death. Kim Jong-un has some difficult decisions to make. He has to decide how hard to lock down, what's going to be more dangerous for his people and his grip on power. Is it for people to get sick or potentially starve to death? The World Health Organization has said it's ready to send vaccines and medicine, but the North has yet to respond. Soon, it might be too late.
We should not wait until they ask for us to help them. Have packages ready, have cargo ready to go, because each day we wait, people are dying.
How many will pay that price before this secretive state opens its doors to help? Jean Mackenzie, BBC News, Seoul.